Hey guys, my name is Dr. Lina and I am on the front lines of the COVID fight. I am a pediatric emergency doctor by training, but now practice telemedicine. I work for a company called MD Live, and currently in our waiting room are 1,900 patients waiting to be seen. Today is March 19th, the first of the COVID updates. I'll be dropping those regularly. Today in the United States, 11,348 cases, 161 deaths. Those numbers are gonna be staggeringly growing in the next few days, partly because the virus is spreading, but partly because testing has become higher. So don't panic when you hear those numbers. I predicted it before. In the next 2 weeks, we're gonna see an alarming rate. What really is a little bit on the alarming side is that people are still not taking social isolation seriously. When you start looking at the curve of the United States, that curve that we want to flatten, it is not being flattened as quickly or at an angle that will follow suit of Korea. Right now, we are really following suit Italy. So some things have to change. Today, this piece of information dropped that 40% of US hospitalized corona patients are ages 20 to 54. Critical piece of information, because those of you who are in that age group need to remember that this applies to you too. Stay home, protect those you love. You too are at risk, is what the data is saying. Does it mean we can't overcome this? No, on the contrary, there are people working on the front lines. Just today, President Trump talked about the fact that there may be a malaria medicine that they're finding might be of use in the treatment of coronavirus. We pray that's the case. Pray for those who are working on these solutions. And in the meantime, do your job, stay indoors. Hey, I want to not just share with you medical information on these clips, but I also want to share with you spiritual things. And so today, I want to strengthen your soul with something I read this morning before I hit the computer and started seeing patients. When you see a mountain of thousands of patients waiting to be seen, you feel like, what in the world am I going to do to help? What will 10 or 20 or 50 or 100 patients that I see do to make a difference? Here's what Mother Teresa said once when she was walking the streets of Calcutta with hundreds of thousands of people in need. She said, I never look at the masses as my responsibility. I look at the individual. I can only love one person at a time, just one. So you begin. I began, I picked up one person. Maybe if I didn't pick up that one person, I wouldn't have picked up 42,000. The same thing goes for you. The same thing in your family, the same thing in your church, your community. Just begin one. Today, be kind to just one person. Love just one person. Be the person that you are supposed to be for that one person that God puts before you. That's how you get the job done. You don't need to save the world. You just need to love the one. Hey, I love you. This is your COVID update with Dr. Lina. I'll be back again tomorrow.